Hi friends, good morning to all of you. I'm Dr. Anshul Bansal, again joining you on this Unacademy platform. In today's YouTube live session, we'll study about fracture healing and its complications. So it is a basic part of the orthopedics. Okay, so it is basically for the NEET PG 2022 or the 23 aspirants or the students in the MBBS who will be giving the prof university examinations. जो basic orthopedics होती है, we'll study this in this lecture, and it is very important to build your concepts, and this lecture will help you to build your concepts when you will study the orthopedics of the upper limb, lower limb, and the fracture proper. Okay, so it is a conceptual session, especially for the NEET PG 22 and the 23 aspirants, and for this year's INICT FMG वाले भी can watch this session. It will be a very quick revision because इस session में से INICT FMG में से भी एक या दो question पक्का से आएंगे. Okay, let's start this session, and before starting I would just like to introduce myself. I'm Dr. Anshul Bansal, currently working as an orthopedic resident doctor in SMS Medical College Jaipur, and I have cracked the NEET PG examination last year, that is in 2020 only. Okay, so before starting, let's just discuss about various subscription plans available on the Unacademy for the NEET PG. The first one is your Plus subscription. The Plus subscribers will get access to all the live and recorded classes. They can compete in live tests and quizzes, and they will be given access to our entire QBank, all of which is found by the topmost faculty for the NEET PG in India. And also we'll allow the subscribers to log into multiple devices with the same account, so that they can study on any device of their choice at any time. And also for the students who will be subscribing for 12 months or more, we will be shortly providing them with a printed notes. Okay, so while subscribing, you can use my code, that is AnshulB10, to get extra 10% off. The second one and the best one is the Iconic subscription. It is best not only on the Unacademy platform but across any digital platform for the NEET PG in India. And what makes this best is that apart from the things that I've told you earlier, in Extra you will get the prep ladder, and all of the prep ladder, including its entire QBanks, the video lectures, the rapid revision courses, the grand test quizzes, etc. Everything you will get. And on Unacademy Extra you will get well structured live batch wise classes, and we have structured our batches and formulated our courses in such a way so as to build your basic concepts about any topic or subject first, then going into its in-depth. And also we'll revise the same topic that is covered in various subjects, like in today's lecture also there will be many points like the heterotrophic calcification, myositis, ossificans, etc., that you'll study in your pathology also and in your medicine also. Sorry. So जहाँ पे भी वो same topic आएगा, we'll revise the things that you have studied about that topic in the other subject, so that आपका revision अच्छे से हो, आपके concepts बहुत अच्छे से build up हो. And also the Iconic subscribers will get an individual test assessment sheet after every test that they give, so that they can analyze themselves कि yes, this topic or this subject needs more revision, या किस type के questions are being framed, or what are the things that I am missing. Okay, या फिर what are the important things in the topic or the subject that I should keep in mind. So it is very important in the planning and analysis of your preparation towards any competitive examination. And Iconic subscribers will have all this, and you can subscribe for this course while using my code, that is AnshulB10, while subscribing, and you will get extra 10% off. Special classes are very special. I always lay emphasis and I always ask you to attend this special class, because they'll give you extra edge over your competitors, and they are very special because you will get a live classroom like feel where you can interact with your educators in the live session. You can participate in polls, you can digitally raise your hand, you can solve your doubts there and there only. You can watch it anywhere, anytime. What you have to do, you have to just download the mobile application of the Unacademy app and and log in using this code of mine, both of which are absolutely free. And also every special class may you will be given the digital notes of that respective class. Also, we have launched a new feature that is called raise a hand feature, and we have launched this feature to make a live classes more interactive. In this feature, you can just tap on a button and digitally raise your hand, so that the educator will come to know about your query and you can solve your doubts there and there only. In this COVID times, everybody is preparing through the digital platforms, and to make this platform more interactive and to increase the two-way communication between the learners and the educators, we have launched this new feature. And you should solve a question bank while preparing for the competitive examinations, because it is very good. 25,000 plus questions to hai, but you will get every type of question practice that you need. Entire theory will be covered, the recent advances, the recall questions, the repeated questions in the previous year's examinations, the high yield MCQs, the images, histopathological slides, the instruments, the clinical case scenarios, x-rays, CTs, MRIs, everything will be covered. So it will contain everything and anything that you require for your preparation for any examination. So you should solve this QBank, and for subscribing for the question bank, you can use my code, that is Anshul B10, to get extra 10% off. In October, we are organizing two grand tests, both of which are absolutely free. The first is the FMG grand test on 17th of the October between 10 a.m. to 1 p.m. And the second one is the INI CET based grand test on 17th October between 2 to 5 p.m. in the afternoon. And it is very important to give this grand test, because both of these examinations are very near. INI CET is in November and FMG is in December. So you need to buckle up and you need to start preparing very sincerely and with very and with all your focus for these examinations. And think is like maybe 3 hours of solving the paper and 3 hours of reading the explanation and the analysis, which is more important. In 6 hours you will be revising the most important 200 topics for the INICT and the most important 300 topics for the FMG. So it will be a very high yielding thing and very important thing for you. So please give the grand test on 17th of the October. Now dedicated to different students who are preparing for different examinations, like some are preparing for 2023 NEET PG or the next examination, or some are preparing for the 2022 examination. So we have started dedicated batches to these courses from 13th of the October, and from 13th of the October we have started a newer very important and interesting batch, that is a clinical case discussion and instruments batch, where you can see the things that you read in the theory कि yes clinically a patient में कैसी दिखती है, so that you are not bored by just reading the theory part and you can build up your concepts. And सबसे important is that you will never forget that once you see a thing, जैसे आप देखते हो in the orthopedics की yes compartment syndrome आप पढ़ते हो, but if you see the clinical photo of the compartment syndrome or the fasciotomy की yes ये ऐसा दिखता है, you will never forget that. And also it will increase your interest, it will generate your interest towards the subject or the topic and your studies, which is very important for cracking any type of examination. So you can subscribe for any of these courses, and while subscribing you can use this code to get extra 10% off. And here are the subscription packages for both iconic as well as plus subscription. And here you can see that the cost per month decreases significantly if you increase the duration of your course. So economically भी अच्छा है, and also academically it is very important that you have a single source of your information and the notes from the beginning of your preparation, because you don't want to hop around and you don't want to study different topics or different subjects from different notes, because it will increase the time for your revision. It will be very difficult for you to revise, and also it will be difficult for you to build the concepts. Okay, the single source of information is very important, and Unacademy is the best platform for this. So I would suggest to subscribe for any subscription package with longer duration, and while subscribing you can use this code of mine, that is Anshul B10, to get extra 10% off. Okay, so let's start today's session about fracture healing and its complications. So सबसे पहले blood supply. So blood supply दो तरीके से होती है. The major blood supply is from the nutrient artery, okay, which enters from into the bone from a foramina called as the nutrient foramina. Okay, there is a nutrient foramen in the bone, and usse the proximal and the distal direction में the branches of the nutrient artery goes and they anastomose with the metaphyseal and the epiphyseal vessels, and it is the major artery supplying the bones, and it supply the 2/3 of the cortex and the entire medullary cavity. The second one is your periosteal vessels. These supply, name से पता चल रहा है, the periosteum, and the periosteum is very rich in blood supply. So periosteum का intact रहना is very important to heal, for the healing of any fracture. Okay, so generally we don't remove the periosteum in the operation, and we try to conserve the periosteum. Okay, and these periosteal vessels supply roughly the outer 1/3 of the cortex. Now fracture healing is similar to the soft tissue healing, but एक ही फर्क है. The soft tissue healing में the healing is by the formation of the fibrous tissues. Okay, but in bone healing or the fracture healing, this fibrous mesenchymal tissue is mineralized and it is replaced by the calcium salts or the bone proper. ओके, सो फ्रैक्चर हीलिंग स्टार्ट कब होती है, एक बेसिक क्वेश्चन है. So fracture healing starts as soon as the fracture happens. Okay, as soon as the fracture occurs, the fracture healing starts. Okay, and it is divided into various stages, the 5 stages called as the frost staging or the frost classification. And the 5 stages are first in the chronological order in which they occur. The first is the stage of hematoma. Then the hematoma will form the granulation tissue, then the stage of callus, then the stage of remodeling and the modeling. Remodeling stage को पहले बोला जाता था stage of consolidation, and modeling stage को पहले बोला जाता था remodeling. But now these terminologies have changed, so please keep these in mind. So first is the stage of hematoma, which occurs as soon as the fracture occurs, and it occurs for the initial 7 days. And hematoma जो होता है, between the fracture sites there is bleeding and there is formation of this hematoma. Okay, and then this hematoma में क्या होता है, there is proliferation of the daughter cells, fibroblasts, osteoblasts, and the neutrophils, etc. So there is formation of this granulation tissue, and फिर इस granulation tissue में there is the granulation tissue कब तक होता है, it is generally for 2 to 3 weeks, and after 3 weeks that is 4 to 12 weeks तक you will have the major stage, very important stage, that is the stage of callus formation. And callus दिखता है x-ray में, and it is the first short sign for the healing of the fracture कि yes, healing अब start हो गई है. And remodeling and the modeling takes years to take place in the fracture healing. Okay, so first is the stage of hematoma that lasts for around 7 days. Okay, and there is sensitization of the precursor cells. So, and after that, in the granulation tissue, these sensitized cells, they differentiate into daughter cells like fibroblast or osteoblast, etc., or they do the angiogenesis. And 4 to 12 weeks mein, there is the stage of callus formation, that is the mineralization of the granulation tissue, and it is visible in the X-ray. ओके एंड जब कैलस बन जाता है यानी प्रॉपर यूनियन स्टार्ट हो चुका है, सो द फ्रैक्चर विल बी लेस एंड लेस मोबाइल, इट विल बी नॉट mobile as in the earlier weeks. Okay, then the remodeling is the mature bone formation or the lamellar bone formation. Okay, and it takes 1 to 2 years, and many years are taken for the modeling processes where the endosteal and the periosteal surfaces are indistinguishable and they are aligned like a normal bone. Okay, so here you can see that hematoma is formed, and this hematoma is replaced by the granulation tissue and the soft callus first. Then there is mineralization of this callus leading to the formation of the hard callus, and then the bone remodeling occurs and the proper shape, the callus takes the shape of the bone, and this is called as the bone remodeling. Okay, so जैसे ही फ्रैक्चर होगा द इन्फ्लेमेशन प्रोसीजर एंड द हेमाटोमा स्टार्ट्स, देन देयर इज cell recruitment and the periosteal proliferation, granular tissue formation, and first of all there will be intermembranous bone formation between the two fracture side, then the chondrogenesis, that is the cartilage production, then the enchondral bone formation, that is the bone formation proper, and then there will be remodeling. Okay, so we'll study about the individual stages. तो stage of hematoma 7 days तक होता है, and कैसे होता है, we have already discussed that after the fracture the blood leaks out and they form a hematoma. Okay, so the periosteal and the local soft tissues are stripped off and there is injury to these parts of the tissues which will lead to the formation of the hematoma. And अगर ये बहुत ज़्यादा होता है तो obviously there will be ischemia leading to the ischemic necrosis of the fracture ends. Okay, now due to this ischemia, there is proliferation of the precursor cells, so some osteocytes will die and they are sensitized, which are called as the sensitized osteocytes, and they will be differentiating into the daughter cells which will later form the fibroblasts, the osteoblasts, etc., which will help in the formation of the granulation tissue and the callus. सेकेंड इज द स्टेज ऑफ द ग्रैनुलेशन टिश्यू जो 2 to 3 वीक्स तक होता है. सो अपन ने अभी जो डिस्कस किया था, द सेंसिटाइज प्रिकर्सर सेल्स और द डॉटर सेल्स, दे डिफरेंशिएट इनटू द various cells like fibroblasts, osteoblasts, or the angiogenetic cells, and they will bridge the gap between the two fractured segments of the bone, and this gap will be filled with the soft granulation tissue. Okay, and this granulation tissue will provide support or anchorage to the fracture. Okay, rigid nahi hoga, but it will be mobile, but yes, it will provide the support. And जो clot बना है, it will eventually be removed by the macrophages, giant cells, and other inflammatory मीडिएटर्स. ओके, सो यहाँ पे हीलिंग ऑफ बोन जो होती है वो सॉफ्ट टिश्यू से डिफर करती है, बिकॉज इन सॉफ्ट टिश्यू देयर इज फॉर्मेशन ऑफ द फाइब्रस टिश्यू यानी फाइब्रोब्लास्ट विल बी मोर, whereas in bone healing there will be more osteoblasts leading to the more mineralization and the deposition of the bone in the granulation tissue. Now सबसे important stage is the stage of callus, which begins from 3 weeks or 4 to 12 weeks. Okay, and इसका एक important बात आपको याद रखना है, it is the first sign of union which is visible on the x-rays. and ये important question है कि कब से visible है, different books में different timings लिखी है. so remember 3 weeks is the most appropriate answer, that 3 weeks after the fracture it will be seen on the x-ray. Okay, so remember this thing. जो कैलस होती है, कैलस इज एन इमेच्योर और द वूवन बोन. रिमेंबर दिस, फिर बाद में ड्यूरिंग द रीमॉडलिंग एक्सेट्रा इट इज कन्वर्टेड इनटू द लैमेलर और द मैच्योर बोन. सो कैलस जो होती है, कैलस इज द वूवन और इमेच्योर बोन जिसमें कैल्सिफिकेशन इज लेस. ओके, एंड ये भी ब्रिज करेगी एंड इट विल गिव द सपोर्ट एंड द रिजिड सपोर्ट एंड स्ट्रेंथ टू द फ्रैक्चर. ओके, अब कैलस जो होता है ये ऑब्वियसली बच्चों में, चिल्ड्रन में इट इज faster. Okay, and it is faster in the cancellous bones, that is at the epiphysis and the metaphyseal area, as compared to the cortical bones or the diaphyseal area. Remember this is important. Now remodeling, जिसको पहले stage of consolidation बोला जाता था, यहाँ पे जो callus या फिर woven immature bone है, it is replaced by the mature or the lamellar bone. Okay, and there will be जो pockets of callus होंगे, it will be replaced by the lamellar bone and there will be mineralization, but it is a slow process. It takes many years, at least 1 to 2 years to take place, and remodeling is very good in children. So due to this very good remodeling in the children, more and more conservative management of the fracture in children can be done, because slight angulation or the slight displacement can be corrected with by proper remodeling. Okay, now the last stage, as the fifth stage, is the stage of modeling, which was earlier called as the stage of remodeling, and इसका main काम होता है the bone को strength देना. ओके, बोन को स्ट्रेंथ देना. सो जो एंडोस्टियल एंड पेरियोस्टियल सर्फेसेस होते हैं, देयर विल बी कॉर्टेक्स जो होंगे. इफ देयर इज अ कैलस फॉर्मेशन, तो कैलस जो होगा वो अलग से दिखता है, बट इन स्टेज ऑफ मॉडलिंग देयर विल बी शेपिंग ऑफ दिस कॉर्टेक्स इन द नॉर्मल एनाटॉमिकल पोजीशन एंड द फॉर्म ऑफ द बोन. सो आपको पता ही नहीं चलेगा कि यस यहाँ पे कभी फ्रैक्चर भी हुआ था, इफ द मॉडलिंग इज वेरी गुड. एंड द मेजर स्टिमुलस इज, ये बहुत इंपॉर्टेंट है, विच इज द मेजर स्टिमुलस फॉर द मॉडलिंग ऑफ द बोन. द मेजर स्टिमुलस इज योर वेट बियरिंग एंड द मसल स्ट्रेच. ओके, और द मसल फोर्सेस. इसलिए एट प्रॉपर टाइम, जब रिजिड हो जाए कैलस बनने के बाद, वेट बियरिंग एंड प्रॉपर फिजियोथेरेपी जिससे मसल फोर्सेस लगे, इट इज वेरी इंपॉर्टेंट फॉर द मॉडलिंग ऑफ द बोन टू टेक प्लेस. ओके, सो इन चिल्ड्रन ये ज़्यादा अच्छा होता है इवन विद द एंगुलेटेड फ्रैक्चर्स. ओके, एंड एडल्ट्स में इट टेक्स मोर टाइम एंड इट इज लिमिटेड. So this is the normal fracture healing. Okay, so this is fracture of shaft of humerus in a child, and here you can see on day 1 there is this fracture, and on the day 4 there will be granulation tissue, but that will not be visible on the x-rays. On day 5 day 7 से बच्चा है, so in children callus formation is also quick. So at the end of the 1 week only you can see here ki yes, there is visible callus formation, and there after 2 weeks the callus formation is beginning to get hardened and replaced by the lamellar bone. Okay, and now there is remodeling and modeling, and here you can see jo callus tha, it was like a defect, but after modeling and remodeling it will take the original shape of the bone, and here you can see that the shape of the bone is maintained. So this is the process of fracture healing. Okay, so here you can see this is fracture of the tibia and it is displaced. So अगर यहाँ पे आप conservative करोगे तो भी the fracture will heal, but to reduce the time of the weight bearing, अपन ने अभी पढ़ा है कि early weight bearing and muscle force से modeling ज़्यादा अच्छे से होगी. So to provide support we have put a tense nail. Okay, tense nail, it is called as tense nail, titanium elastic nailing system, tense nailing system. Okay, or also called as the Anders nail, used in the children. Okay, so it is used so that alignment proper ho, weight bearing jaldi hoga. So here it is the callus formation, and here you can see that very good healing and the new bone formation and modeling and remodeling has occurred. So this is a case of fracture healing after doing the operation by inserting the tense nail. Now healing of cancellous bone, so similar ही होता है, बस ये ध्यान रखना है cancellous bone की healing का prognosis is more good and time जो लगता है वो कम लगता है. So healing बहुत ज़्यादा अच्छी होती है in cancellous bone as compared to the cortical bone. Okay, so there is no medullary cavity in the cancellous bone, so there will be more contact between the trabeculae, okay, and the union can occur directly between the bony trabeculae. So hematoma, granulation formation, सारा procedure वही होगा, but the timing will be less and the prognosis and the outcome will be better in case of cancellous bones. Okay, now bone healing भी दो टाइप की होती है, the primary and the secondary. So the primary fracture healing होती है, primary fracture healing होती है, it is that fracture healing in which the hematoma has been disturbed. Okay, if the hematoma is disturbed, it is called as the primary fracture healing, or it is generally seen in case of the fractures treated operatively. Okay, so the bone will heal directly with less callus formation because hematoma हटा दिया है. So hematoma के अंदर ही precursor cells बन के osteoblast, fibroblast होते हैं. So there will be less callus formation and it will take more time and it will be difficult to evaluate the union on the x-rays, whereas in the secondary fracture healing the hematoma is not disturbed. Okay, hematoma is not disturbed as in treated in non-operative cases या operation में भी a newer technique called as the MIS or the MIPO, that is the minimal invasive surgeries, where minimal invasive surgery, in this you don't give a incision. like अगर यहाँ पे fracture है अल्ना का, so प्लेट लगानी है अल्ना में, so you will not open from this to this, इतना बड़ा incision नहीं दोगे, because इतना बड़ा fracture site को जैसे ही आपने open कर लिया, the hematoma will be disturbed and hematoma disturb करोगे तो fracture healing will be delayed. Okay, so if secondary fracture healing करनी है, जल्दी करनी है without disturbing the hematoma, and also there will be less chances of infection because आप इतना open नहीं करोगे, so just we'll open small area of this side and small area of this side, and we'll put the plate from this and we'll lock the plate here and here, and by seeing the operative procedure under the IITV or the CR machine or the image intensifier, and we'll reduce the fracture site by proper manipulation and instrumentation under the image intensifier. So this is a newer technique and very good technique, because if the fracture site ko you will not open, so there will be no disturbance of the hematoma, precursor cells या healing या callus जल्दी बनेगा, and secondly there will be very less chances of the infection. Okay, so this so hematoma plays a major role in the healing, and we have discussed why and how. Okay, now very important is the factors which will affect the fracture healing. The सबसे first and the most important most important factor is the age of the patient. It is faster in the children. Okay, and non-union or delayed union is very uncommon in the children, and the callus will be visible on x-ray as early as 2 weeks only after the fracture. Okay, so the timing of the healing will be greatly reduced if the age is less. Type of the bone we have already discussed, ki cancellous and the flat bones may the healing will be faster as compared to the cortical and the tubular bones. And the pattern of the fracture, transverse fracture जो होता है उससे जल्दी यूनियन होगा ओब्लिक फ्रैक्चर में, एंड ओब्लिक फ्रैक्चर से भी जल्दी यूनियन होगा किसके अंदर, स्पाइरल फ्रैक्चर्स में, बिकॉज more surface will be of the fracture sites will be in contact with each other, so the healing will be बेटर. ओके, ट्रांसवर्स के कंपैरिजन में ओब्लिक में ज्यादा अच्छा होगा एंड ओब्लिक के कंपैरिजन में स्पाइरल में ज्यादा होगा. कम्यूटेटेड फ्रैक्चर्स आर द फ्रैक्चर्स विद द पुअर प्रोग्नोसिस, बिकॉज they are generally due to severe trauma and osteoporotic bones के अंदर होता है, and they are open. So open fractures and commutated fractures में the healing is slower as compared to the other fractures. So remember this also. आपको image दे सकते हैं fracture की, अलग अलग type के fracture की, and you will be asked कि which fracture will be healed सबसे early. Now disturbed pathoanatomy. Okay, क्या होता है कि after the fracture occurs there is some disturbance like fracture ends के बीच में कोई soft tissue का interposition हो सकता है, या there can be ischemic fracture ends leading to the avascular necrosis called as the avian, and all these will hamper the healing and the union of the bone. Okay, so जब भी fracture होता है, the displaced segment will be the displaced fracture जो होंगे they will be interposed in the soft tissues, and दोनों fracture segments के बीच में there will be soft tissue, so you need to remove that soft tissue जो इनके बीच में आ गया है, so that the fracture ends are approximated and there is good union. And similarly there is injury to the blood vessels and the soft tissues, so the blood supply will be hampered very greatly, and there will be ischemic ends, and it will lead to the ischemia of the bone leading to the avascular necrosis, and that will go into the non-union. Okay, so this soft tissue will prevent the callus from bridging the fragments. Okay, and जो avascular necrosis होता है, it is very common in the scaphoid fractures, fracture neck of femur, fracture talus, which we'll all see in the coming slides. Okay, so vascularized bone ends are important for optimal fracture union. ओके, ये हमेशा ध्यान रखना है कि वेस्कुलराइजेशन यानी पेरियोस्टियम जो होती है, ये इट इज वेरी वेरी इंपॉर्टेंट इन द हीलिंग ऑफ द फ्रैक्चर. नाउ टाइप ऑफ रिडक्शन. ओके, अगर रिडक्शन बहुत अच्छा है, लाइक दिस इज योर लाइक दिस इज योर फ्रैक्चर, और अगर ये ऐसा ही है सो इसमें रिडक्शन इज गुड, सो हीलिंग विल बी गुड. अगर ये ऐसा है या ऐसा है, सो ऐसे फ्रैक्चर्स में क्या होगा, हीलिंग में प्रॉब्लम आएगी. ओके, सो टाइप ऑफ रिडक्शन, सो at least half of the fracture surface should be in contact for optimal union of the adults. Okay, but in children this side to side या फिर बहुत ज़्यादा अच्छा रिडक्शन नहीं होगा, फिर भी ड्यू टू वेरी गुड रीमॉडलिंग एंड द मॉडलिंग प्रोसेसेस the union is very good, and this is called as the bayonet reduction. ये ध्यान रखना है, this is called as the bayonet reduction. See, this is the bayonet reduction कि adult में अगर ये आप as it is छोड़ दोगे, so there will be 110% there will be malunion, there will be shortening, and there will be functional disability. But in the adults callus formation bana, and there is pretty good remodeling and the modeling, and here you can see that this angulation is not there in the heel fracture. This is called as bayonet reduction seen in the children. So that's why in children more and more fractures can be treated conservatively. Okay, now immobilization से क्या होता है, we have already discussed कि proper time पे या early mobilization is important for the modeling process. That's why more and more emphasis is given to the operative techniques, so that immobilization ज़्यादा टाइम तक नहीं करना पड़े, मॉडलिंग अच्छे से हो, वेट बियरिंग मसल फोर्स अच्छे से लगे, एंड ऑल्सो there is no complication of joint stiffness etc. Okay, so कुछ फ्रैक्चर्स तो ऐसे होते हैं जिसमें यू डोंट नीड टू इमोबिलाइज एट ऑल, इमोबिलाइजेशन की जरूरत ही नहीं होती, लाइक फ्रैक्चर ऑफ द रिब्स और द स्कैपुला, दे विल हील एनीवे. whereas there are certain fractures जिसमें you need a very rigid and strict immobilization, that too for very long duration, like the fracture of neck of femur etc., and still they will not heal. So immobilization depends on the फ्रैक्चर टाइप्स. ओपन फ्रैक्चर्स में इन्फेक्शन के चांसेस बहुत ज़्यादा होते हैं. देयर इज वेरी large soft tissue injuries and the blood loss, तो जिसकी वजह से the healing is not good, and most open fractures जो होते हैं there will be delayed union or the non-union. Now compression at the fracture site, in general speaking compression जितना अच्छा होगा fracture site पे उतना ही ज़्यादा approximation होगा fracture ends का, so the healing will be better, and especially in the cancellous bone. But ये remember this thing that compression should not be बहुत ज़्यादा, otherwise it will lead to the compartment syndrome etc. Okay, so in cortical bones the compression will enhance the rigidity of the fixation, and it will improve the results of the bone healing. Okay, so this is your bayonet reduction that we have discussed. Okay, this is the bayonet reduction that we have already discussed. Now what is the pathognomic size or sign of traumatic or any fresh fracture? So जो pathognomic sign होगा that will be the crepitus. And how would you elicitate this crepitus? Crepitus को elicitate करने के लिए जो भी fracture site है वहाँ पे you just do the palpation, you just put the pressure. Okay, and you will feel a sound of the crepitus there. जब bony fracture ends will move against each other, there will be sign of the crepitus. And which is the most common cause of non-union? Non-union का most common cause is your inadequate immobilization. Remember these things. Okay, inadequate immobilization is the most common cause of non-union. Now there are certain markers which are important for examination point of view, especially for the INICT में markers are frequently asked. So bone formation के कौन कौन से markers होते हैं? It is the bone specific alkaline phosphatase, the osteocalcin, and the type 1 collagen peptide. And what are the markers of bone resorption? Bone resorption में in urine as well as serum you will have cross-linked N-telopeptide and C-telopeptide, and in urine you will see the deoxypyridinoline, that is the free deoxypyridinoline. Okay, so the और अगर आपको चेक करना है कि रेट ऑफ मिनरलाइजेशन कैसा है या हीलिंग कैसा है, यू कैन डू इट विद द हेल्प ऑफ लेबल्ड टेट्रासाइक्लिन. So labeled tetracycline is used to determine the rate of mineralization. All these are the direct questions, you just need to remember these things. Okay, now we'll come to the complications of the fracture. Complications of the fractures जो होते हैं, it can be divided into three broad groups depending on the time of the occurrence. जो fracture होते ही हो जाए, that is the immediate complications. After few hours or few days, initial few days में हो, these are the early complications, and late complications long time after the fracture. Okay, so ये जो complications है इसमें the immediate complications are your neurovascular injury or the blisters around the fracture. Okay, these or the hemorrhagic shock, these are all the immediate. And early में you can have the compartment syndrome, the infection, the DVT or the embolism, ARDS, sepsis. All these are the early complications. And late complications will be the non-union or the malunion, delayed union, avascular necrosis, osteomyelitis, myositis, ossificans, that is the heterotropic ossification, joint stiffness or arthritis, or the Sudeck's osteodystrophy. We will discuss all these. So these are the late complications. तो सबसे first we'll discuss about the hypovolemic shock. Hypovolemic shock नाम से पता चल रहा है, due to very large blood loss there will be the hypovolemic shock. So it is the commonest cause of death after the fracture in the major bones like the femur or the pelvic bones. Okay, pelvis and femur में आपको specially ध्यान रखना है hypovolemic shock का. So every femur patient, every femur fracture, pelvis fracture patient को, even if it is undisplaced, you need to keep them under observation for at least 1 to 2 days, because there will be great blood loss. In pelvic fractures around 2 liters, whereas in femur fractures around 1 to 1.5 liter of the blood loss will be there. So you need to do the transfusion. And also अगर आप बहुत ज़्यादा डिस्प्लेस करोगे तो देयर विल बी चांसेस ऑफ एम्बोलिज्म. सो एंड व्हाई देयर इज सो मच ग्रेट ब्लड लॉस इन दीज बोन्स के फ्रैक्चर में, बिकॉज दीज आर द प्राइमरी साइट ऑफ योर हेमाटोपोइसिस. ओके, सो हेमरेज एक्सटर्नल भी हो सकता है अगर देयर इज ओपन इंजरीज एंड इंटरनल हेमरेज. सो इवन इफ द फ्रैक्चर इज क्लोज, देन ऑल्सो the bleeding is great, but that is internal, वो आपको दिखती नहीं है. So you need to keep in mind कि femur fracture and pelvic fractures जो होते हैं, they have a high chances of hypovolemic shock and it can even lead to death of the patient. तो उसके लिए मैनेजमेंट में क्या करना है? As soon as it is diagnosed, immobilize in the particular way. Like femur fracture के लिए you do the Thomas splint and the BK traction. With the limb elevated in the pelvic fracture, you will do the BK traction or the pelvic harness or the binder if required. And diagnosis होते you will give the IV analgesics and you will push fluid. Okay, खूब सारा fluid, IV fluid you will give. Okay, with a large bore cannula. And ये जो cannulas होती है, इसके size and the color codings are very very important. In every year they ask. In the last INI-CT also there was a question on this. So in every INI-CT of the NEET PG, at least one question cannula या इनमें से आता ही आता है. Very important. Just revise this 1 or 2 days before giving any examination. So firstly what you will give, ये अब important है. First fluid that you will give will be the crystalloids, that is the ringer lactate or the RL. At least 2 liters of the fluid you will give. Then you will give the colloids like the Hemacil or the NS and the blood. Okay, so direct blood नहीं लगाते हैं generally. First you give the crystalloids, then you go for the blood transfusion. Okay, and if there is any chest injury, you have to put the ICD, that is the intercostal drainage tube, or the laparotomy in case of abdominal bleeding. Okay, and if there is excessive open wound, you need to tie the sutures, you need to give the compression to stop the bleeding. Okay, and if there are any chances or any probability of any vascular injury, you have to go for the emergency angiography and the embolization of the bleeding vessels. Okay, so agar trauma emergency में you get any case of a open fracture with vessel cut, and you can easily see the vessel cut, and you can easily see कि yes ये एक bleeding site है जहाँ से heavy bleeding होती है. Don't think about anything else, just open a vicryl and ligate the ends of the vessel so that the bleeding is stopped. ये बहुत बहुत important होता है. Then pack the area and send it to the ward where it will be managed by the CTVS surgeon or the plastic surgeon with the orthopedician. Okay, so stopping of the bleeding is very very important. Okay, so this is all about the hypovolemic shock, and these are the cannula की color coding with the bore size. तो जब भी कोई hypovolemic shock के अंदर होता है या during giving the CPR, you use the 14 gauge and the 16 gauge needle. Okay, so and most commonly used is the 22 gauge blue, 16 is your gray, 14 is your orange, 18 is your green, 20 is your pink, 24 is your yellow, and 26 is your violet. Mostly 24 is used in case of children. So at least आपको इतना याद होना चाहिए कि which color coding is which gauge, और ये ध्यान रखना जैसे जैसे if you decrease the gauge the bore size will increase. Okay, तो उल्टा होता है, ये ध्यान रखना है. And just take a screenshot of this slide and just revise it. ऐसी 100 slides आप बहुत easily सिर्फ 15 to 20 minutes per day में you can just see and revise them, and it is a very smart and important way to revise the things and to prepare for your examinations, because ये सारी चीज़ें आपको जनरली आपके नोट्स वगैरह में नहीं मिलेगी, और नोट्स में कहीं एक या दो जगह मिल भी गई तो आपने एक बार पढ़ लिया, then you will not study them for months and पक्की पक्की बात है that you will forget them. Okay, so best way to remember such things is to revise them and just see through such pictures after every 1 week or 2 weeks, so that they will be in your subconscious mind. So very important है ये cannula की color coding and the gauge size. Okay, very important. Please do learn them before going into your examination. Okay, now adult respiratory distress syndrome, ARDS, can be a sequelae of trauma, and it is very common, which will lead to the shock. Okay, so the exact mechanism is not known, but it is generally due to the inflammatory mediators which will disrupt the microvasculature or the capillary blood supply of the pulmonary system, and it will lead to formation of the कंसोलिडेशन के पैचेस या स्नोस्टॉर्म अपीयरेंस, पल्मोनरी इनफिल्ट्रेट्स हो जाएंगे, which will lead to the snowstorm appearance in chest x-ray. Okay, so it usually occurs after 1 day of the injury, and symptoms obviously क्या होंगे, tachypnea and the distressed breathing or the labored breathing. The arterial PO2 will fall, and you can do the analysis by the arterial blood gas analysis, that the ABG, and management में you will give the 100% oxygen, that too with the pressure and the assisted ventilation, and injection hydrocod, nebulization, etc., and the proper care of the fracture site like limb elevation. कम से कम the displacement or shifting of the patient should be minimal, so that there are less chances of the embolism and other complications, and in 1 week around the patient will recover and the patient will get healthy. So adult respiratory distress syndrome identify करके manage करना बहुत important है, and management is easy also, but अगर timely manage नहीं किया then it can lead to the death of the patient. Now fat embolism syndrome, fat embolism यानी fat का embolism बन जाए, and it is very common in case of fracture of femur, that too fracture shaft of femur में. Okay, जो large bones होती है, in large bones there are high chances of fat embolisms. Okay, so this is a very serious complications, and the embolism is in the form of the fat globules. Okay, so marrow के अंदर fat होता है, या आसपास के जो adipose tissue है वहां से fat आ जाता है. Okay, so it are most common in case of large bone के fractures like femur or multiple bone fractures. So फैट कैसे आ सकता है? फर्स्ट ऑफ ऑल बाय द एक्शन ऑफ द लाइपेजेस on the adipose tissue or the neutral fat, there will be free fatty acid which will be released into the bloodstream, and then these will be converted into the thrombus by the aggregation of the platelets and the fibrin, and then there will be the obstruction of the pulmonary vessels by these fat globules. Okay, and symptoms जो होते हैं, symptoms are of the ARDS only, like the tachypnea, there will be tachypnea, labored breathing, and there will be an important feature, that is your petechial rash or the striae. Okay, there will be petechial rash in petechial rashes in case of fat embolism, and especially in the anterior axillary folds or the nape of the neck and the chest or the conjunctiva. Okay, so जो presenting features होते हैं ये दो टाइप में होता है. फर्स्ट ऑफ ऑल cerebral and second is pulmonary. Cerebral अगर हुआ यानी embolism is in the cerebral circulation, then the patient will be drowsy, restless, disoriented, and it will go into coma. Whereas in pulmonary, there will be tachypnea, tachycardia, etc. So diagnosis में in the sputum and in the urine you can see the presence of the fat globules. In the chest X-ray you can see the pulmonary infiltration or the snowstorm appearance, or you can go for the CT angiography of pulmonary trunk, where you can very easily see कि yes यहाँ पे there is emboli and there is loss in the blood supply, yani there is some thromboembolic event. Okay, so in addition to the classical clinic features, there will be can be sign of retinal artery emboli also. Okay, very common, where you can see the hemorrhages and exudates in the retina on doing the examination of the retina. And clinically you can very easily diagnose it with the correlation with the type of the fracture. There will be obviously PO2 और SpO2 of the blood will be decreased, and एक emulsification के लिए एक substance use करते हैं, that is a mixture of 5% dextrose with 5% of the alcohol. It is given IV for the emulsification of the fat. So treatment में respiratory support by 100% oxygen and the assisted ventilation, heparinization giving the heparin or the low molecular weight heparin, and also giving the dextran and the corticosteroids. And the corticosteroid for choice here is the hydrocortisone injection, hydrocortisone. So these are the treatment of the fat embolism. Okay, and as soon as the shaft of femur या कोई ऐसा multiple fracture वाला patient आता है, you start this treatment as a prophylaxis only, hydrocortisone, dextran, etc. But you will not start the heparin or the low molecular weight heparin. And also very important investigation to do the diagnosis, एक तो CT angio हो गई pulmonary trunk की, and second are your quantitative D dimer test. Okay, quantitative, you will do the quantitative D dimer test. Okay, and its value will be greatly increased in case of embolism. Okay, FDP and D dimer. FDP means fragmented degraded platelets. Okay, here you can see these are the petechial rashes in the anterior axillary fold in the conjunctiva, and in the histopathological slide you can see that there is this fat globule here. Okay, and this is the snowstorm appearance in the chest X-ray, where you can see the multiple pulmonary infiltrates. Okay, multiple pulmonary infiltrates. We are the multiple pulmonary infiltrate that you can see. So next complication is your DVT, that is deep vein thrombosis and the pulmonary embolism. So deep vein thrombosis पहले बनेगा, and this thrombus can lead to the formation of the embolism, and that embolism can migrate and can struck down in your pulmonary circulation. Okay, so remember DVT, it is also very important. Okay, so DVT जो होती है, इसका most common cause is your prolonged immobilization, because there will, अगर बहुत time तक immobilization हुआ, and DVT is common in the lower limbs. Okay, so lower limb की injuries में या spinal की injuries में ये होता है, because prolonged immobilization की वजह से there will be venous stasis, and बहुत time तक stasis होगा तो there will be formation of thrombus in the venous systems, and these thrombus can migrate to the pulmonary vasculature and forming the pulmonary embolism. Okay, most common site of DVT is your around the knee, that is proximal knee. ओके, यहाँ पे DVT के या pulmonary embolism के चांसेस बहुत ज़्यादा होते हैं. 1 to 2 days में you can see the signs and symptoms of the DVT. तो वही same signs and symptoms होंगे pulmonary embolism के, and DVT proper के जो signs and symptoms होंगे, this will be the acute calf tenderness and the pain and the Human sign, very important, and it is more common in old age, elderly people and the obese patients, because में पहले से ही fat and calcification of the arteries and the vessels and the veins बहुत ज़्यादा होता है, तो they are where they are at high risk of the deep vein thrombosis and the pulmonary embolism. So ऐसे cases को post operative में जैसे ही operation हो जाता है, you start tablet aspirin 75 mg as a prophylaxis of the DVT, okay, especially in the arthroplasty patients, because वो सारे old age ही होते हैं generally. So after doing the arthroplasty, that is total hip replacement or total knee replacement, कुछ टाइम के लिए उनको इमोबिलाइज करके रखना पड़ता है, तो so you start the tablet aspirin 75 mg as the prophylaxis. Okay, so DVT 1 or 2 days में हो जाता है, and embolism को होने में 4 to 5 days लगते हैं. And very important is the calf tenderness. Okay, calf tenderness, if you'll walk या फिर without walking also at rest, there will be acute severe pain in your calf region, that is posterior side of the leg, which is called as the claudication. Okay, which is called as the claudication. Okay, and if there is pulmonary embolism, there will be tachypnea, breathlessness, chest pain, or even hemoptysis. Now what is Human sign? Very important कि जब आप passive stretch करोगे उस limb को, then the calf, then the tenderness will be aggravated. Like in case of DVT in the lower limbs, what you can do, if you passively dorsiflex the ankle sorry, if you passively dorsiflex the ankle towards the shin of the leg like this, so if there is very acute, बहुत ज़्यादा pain in the calf region with tenderness, then this is positive Homan sign and you can suspect DVT. Okay, so DVT का prophylaxis क्या होता है? Very very important. Every surgeon या every MBBS graduate should know this. First of all, elevate the limb. So as soon as the patient comes, we elevate the limb and we say them कि दो तकिए खरीद के लेके आओ, buy 2 pillows and put the limb, lower limb on the pillow, and if the injury is in the upper limb, we elevate the upper limb like this. Okay, loose elastic bandages, compression bandages आती है, and the anticoagulant therapy. Okay, and for the pulmonary embolism, the respiratory support and the heparin therapy that we have discussed in the previous slides is required. Okay, so इसलिए now more and more focus is on the operative procedures in the orthopedics, because early internal fixation will allow early mobilization and the weight bearing, जिससे आपकी modeling या healing भी अच्छे से होगी, and also the complications of DVT, joint stiffness, etc. are decreased to a very great deal. Okay, so what is this? This is Human sign. How the, here you can see this is the dorsiflexion of the ankle, and there will be pain and tenderness in this calf muscle, which will be if it is so, it is positive Human sign, which will point to towards that there are high chances of deep vein thrombosis. Okay, now next a complication is your crush syndrome. Okay, next complication is your crush syndrome. Okay, so in crush syndrome, नाम से पता चल रहा है, there will be severe trauma and there will be crushing of the soft tissues, the muscles, the bones, etc. Okay, so क्या होगा? There will be release of myohemoglobin in the circulation, and majorly it will affect the kidneys. Okay, and it will precipitate in the renal tubules and it will lead to the ARF, that is the acute renal failure. Okay, so crush syndrome, severe trauma, open wounds या फिर multiple comminuted fractures में it is very very common. Okay, so acute tubular necrosis in the kidney with होगा, so there will be scanty urine and restlessness and delirium and apathy due to increase in the accumulation of the अमोनिया एंड यूरिया एक्सेट्रा। ओके, सो 2 to 3 days के बाद होगा, यानी इट इज नॉट द इमीडिएट, इट इज द अर्ली कॉम्प्लिकेशन। ओके, सो फर्स्ट एड ट्रीटमेंट जो होता है क्रश, एंड ऑल्सो दिस क्रश सिंड्रोम एक और वजह से होता है, दैट कैन बी ड्यू टू टाइट टॉर्निकेट। ओके, टाइट टॉर्निकेट एंड for the excessive time you can have the crush syndrome, and उसके साथ में you can have the nerve palsy or the blockage of the vessels leading to the gangrenous changes also. So tourniquet apply करने से पहले you need to remember कि yes time period is का ध्यान रखना है। in lower limb 1.5 hours is the maximum, and in the upper limb 1 hour is the maximum, and that should not be too tight। ओके, सो ट्रीटमेंट फर्स्ट एड इज वेरी नेसेसरी, टॉर्निकेट इज नेसेसरी। अगर ब्लीडिंग नहीं रुक पा रही है, सो यू कैन अप्लाई द टॉर्निकेट, बट इट शुड बी रिलीज्ड ग्रेजुअली एंड ऑन टाइम, and if oliguria is developed then you have to treat it for like the acute renal failure। Okay, so crush syndrome is very important. In urine you can easily see the myoglobin। Okay, now डिफरेंट नर्व्स जो इंजर होती है, किस फ्रैक्चर्स में मोस्ट कॉमनली नर्व्स इंजर होती है, कौन सी, एंड हाउ विल यू एलिसिटेट दैट। तो एक्सिलरी नर्व इज मोस्ट कॉमनली इंजर्ड इन डिसलोकेशन ऑफ द शोल्डर, एंड देयर विल बी डेल्टॉइड पैरालिसिस इन द डेल्टॉइड रीजन। यहाँ पे देयर विल बी हाइपोएस्थेसिया, लॉस ऑफ सेंसेशन, ऑल्सो रेजिमेंटल bad sign। So axillary nerve in dislocation of the shoulder, radial nerve is in the shaft of humerus fracture, that too most commonly at the junction of the distal 1/3 and the middle 1/3, which is called as the Holstein-Lewis fracture। Okay, this is called as the Holstein-Lewis fracture of the humerus, and wrist drop होगा। सुप्राकॉन्डाइलर फ्रैक्चर ऑफ द ह्यूमरस में मीडियन नर्व रेडियल नर्व दोनों हो सकती है, बट मीडियन नर्व इज द मोस्ट कॉमनली नर्व इंजर्ड। सो देयर यू विल हैव द पॉइंटिंग इंडेक्स और द ऑस्नस क्लैस्प इंडेक्स लाइक दिस। ओके, ये ऐसे फ्लैक्स नहीं हो पाएगा इन द अफेक्टेड हैंड और द अफेक्टेड लिम्ब। Okay, in medial epicondyle of the humerus you will have the ulnar nerve injury, where you will have the claw hand, and in case of hip dislocation, most commonly the posterior hip dislocation or knee dislocation or fracture of the neck of fibula, okay, you will have an injury to the sciatic nerve in the case of hip, and knee में the common peroneal nerve which is the branch of the sciatic nerve, and in दोनों के केस में you will have the foot drop, and in दोनों के ही केस में you will have the foot drop। So it is very important, just remember these things। Now next is your compartment syndrome। Okay, very important। क्या होता है कि कोई सा भी लिम्ब हो, इट देयर इज कंपार्टमेंट, स्किन, स्किन के अंदर देयर इज फेशिया, फेशिया के अंदर देयर इज द मसल्स, इन द एंटीरियर कंपार्टमेंट, लेटरल कंपार्टमेंट, पोस्टीरियर कंपार्टमेंट, उसके अंदर देयर इज द बोन्स व्हिच आर कनेक्टेड विद द इंट्रोशियस मेम्ब्रेन। ओके, सो इफ देयर इज हाई प्रेशर, ओके, ड्यू टू टाइट कास्टिंग और due to large hematoma etc, so क्या होगा, there will be increased pressure in this compartment, and इस increased pressure की वजह से क्या होगा, the vessels and the nerves will be compressed। so nerves compressed की वजह से there will be paresthesia, numbness, tingling, or even loss of the sensory and motor functions, and vessel में compression की वजह से there will be decreased blood supply which can lead to the gangrenous changes also, and necrosis of the muscles, and when these muscles will heal, so there will be fibrous healing which will lead to the formation of the contractures। Okay, so the causes can be due to any injury leading to the edema of the muscles or the fracture, hematoma or ischemia to the compartment। ये याद रखना, कभी भी ओपन फ्रैक्चर्स या फिर कंपाउंड फ्रैक्चर्स जो होते हैं, यानी फ्रैक्चर्स विद लार्ज वुंड, उसमें कंपार्टमेंट सिंड्रोम नहीं होगा, बिकॉज प्रेशर बिल्डअप ही नहीं हो पाएगा, बिकॉज प्रेशर को रिलीज होने के लिए यू हैव अ वे। ओके, सो ओपन फ्रैक्चर्स या कंपाउंड फ्रैक्चर्स में देयर विल बी नो कंपार्टमेंट सिंड्रोम, रिमेंबर दिस। ओके, yes, there are 5 P's in the compartment syndrome। The first P is your pain, then pallor, then paresthesia, okay, pulselessness etc। First symptom and the pathognomic symptom is your pain. पेन जो होता है कंपार्टमेंट सिंड्रोम का, इट इज आउट ऑफ प्रपोर्शन पेन, यानी कोई भी फ्रैक्चर या जो ऐसी इंजरी होती है जनरली, उस इंजरी से जो नॉर्मल पेन होता है उससे बहुत 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 ज़्यादा पेन होगा. ओके, एंड दे विल नॉट बी कंट्रोल्ड बाय द एनसेड्स एक्सेट्रा. सो आउट ऑफ प्रपोर्शन पेन. एंड लास्ट थिंग इज द पल्सनेसनेस. लेकिन ये ध्यान रखना, पल्स जो पेरिफेरल पल्स होती है, इट इज not the pathognomic sign of the compartment syndrome, because at the final stages of the compartment syndrome maybe you can feel the pulse, or even when the compartment syndrome is not set in, you will sometimes not be able to feel the pulse if it is feeble due to hypovolemic shock, etc. Okay, so this is the normal compartment where you can see that this is the outermost covering, that is the skin, fascia, bone, the muscle compartment, okay, and the interosseous membrane. Okay, so consequences क्या होगा, it is a vicious cycle. It is a vicious cycle जो जब तक पूरा गैंग्रीन या नेक्रोसिस नहीं हो जाएगा, it will the cycle will be repeated. So timely intervention is very very important. So क्या होगा, if there is any trauma, so muscle ischemia, hematoma formation हुआ, compartment में pressure बढ़ा, there will be histamine release. So histamine या other inflammatory mediators के release की वजह से what will happen, the permeability of the capillaries will be increased, which will lead to the intramuscular edema and the venous stasis. So जिसकी वजह से again the intramuscular pressure will increase, venous obstruction होगा, and there will be arterial obstruction and the nerve compression. So this is a vicious cycle which will repeat. Okay, so इसका prophylaxis as well as treatment is very important. Compartment syndrome, remember, it is an emergency. Okay, compartment syndrome is a surgical emergency. It can lead to the permanent amputation and the gangrene of the limb. Okay, so every MBBS student should know how to diagnose the compartment syndrome and how to manage the compartment syndrome. ये बहुत 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 important है, and it is very easy. Diagnosis, there are certain fracture sites या injuries जहाँ पे compartment syndrome के chances बढ़ जाते हैं. First of all, कभी भी open या wound के साथ कोई fracture या compound fracture है, उसमें there will never be a compartment syndrome firstly. And there are certain fractures जहाँ पे compartment syndrome के chances बहुत बढ़ जाते हैं, like fracture of the supracondylar humerus, the both bone forearm fractures, the proximal tibia fractures, and the distal tibia fractures, very very important. And in case of crush injuries to the leg and the bone forearm, but they should be closed. Okay, there will be formation of contractures due to healing with the fibrosis, and nerve damage की वजह से motor या sensory loss हो सकता है, gangrene हो सकता है, and diagnosis is by the excessive pain. And also skin condition में you can see the skin is tense, there is very very large swelling, and एक और बहुत important feature होता है compartment syndrome का, which you will see, that is your blisters. Okay, blisters are very very common feature, okay, in compartment syndrome. And blisters दिखने से या tense skin swelling of the skin and excessive excruciating out of proportion pain, ये सब हो. So you should form the diagnosis of the compartment syndrome. Okay, so compartment syndrome के लिए भी there is a stretch test, and it is the earliest sign of the impending compartment syndrome. So earliest sign is the stretch test. So compartment syndrome, अगर if you look about the upper limb, so it forearm में it will be in the flexor compartment. Okay, so if you extend the wrist like this, so there will be pressure on the flexor compartment. So on extension of the wrist, there will be acute severe excruciating pain in the flexor compartment, and this is positive stretch test. Okay, and you should think of the compartment syndrome as soon as the stretch test is positive. Similarly, in the lower limb, if you passively stretch the ankle, okay, then you will have severe pain in your calf region, okay, and a pressure higher than 40 mm of water, okay. 40 mm of water is indicated of the compartment syndrome. So compartment syndrome का treatment से ज़्यादा important is your prophylaxis. So prophylaxis में what you do, prophylaxis में आपको कुछ चीज़ें करनी होती है जो we do for the every patient, and especially with the patient of proximal tibia, distal tibia, both bone forearm, supracondylar humerus, etc. So first is the limb elevation, loose plaster, and जो slab बन के आती है we also slit the slab, okay. So प्रेशर जो हो तो वो थोड़ा बहुत रिलीज हो जाए. लिम्ब एलिवेशन, लूज प्लास्टर, एंड वी गिव टैबलेट काइमोट्रिप्सिन as a prophylaxis, tablet chymotrypsin as a prophylaxis, and active finger movements and active toe movements are very important, either actively or passively. ये सारी चीजों से it can greatly reduce the chances of impending compartment syndrome. और अगर compartment syndrome हो गया है so to save the limb, to save the muscles from the gangrenous changes or the nerves from being compressed, you should release the pressure. Pressure release करने का ये है कि compartment को ही खोल दो, है ना. If you open the compartment, then the pressure will be released. So what you do the fasciotomy, where you जो fascia का plane होता है, that is in the longitudinal direction, you cut the skin then to the deep fascia, not the muscles, okay. So if you see any fasciotomy, you should see, and it is very easy. As soon as you will put the incision, the muscle will bulge out, and they will be hypertrophy तो नहीं बोलेंगे, but the muscle will be very swelled, and they will bulge out like a balloon from that small incision site, okay. So fasciotomy, it is the treatment of choice in case of compartment syndrome. And fibulectomy क्या होता है, फिबुला जो होती है in the upper or the proximal and the middle part, it is of no functional use. So middle 1/3 of the fibula को you can excise so that compartment के अंदर और pressure remove हो जाए, and all the compartments of the leg can be decompressed. So this is called as your fibulectomy. And here you can see, as I have told you, tense skin, swelling, and blister formation. So this is a case of impending compartment syndrome, okay, impending compartment syndrome. And don't rely on the peripheral pulses for diagnosing the compartment syndrome, and why we have already discussed that. So उस पे question आता है, and the wrong option is about the pulselessness, कि pulselessness से you cannot diagnose the compartment syndrome. It is not a sure shot sign of the compartment syndrome, okay. Now next is the डिलेड यूनियन एंड द नॉन यूनियन, ओके. सो किसी भी फ्रैक्चर को डिलेड या नॉन यूनियन बोलने के लिए एटलीस्ट यू हैव टू वेट 6 months, because there are very many factors like the age, etc., that we have discussed, that helps in the, and that plays a major role in the union, okay. So at least 6 months you should wait, okay, and you should do the serial x-rays over a period of time to see the evolution of the callus, okay. So if after 6 months or for a reasonable period of time, if there is pain and mobility, pain से भी ज़्यादा important is the mobility at the fracture site, then you should suspect non-union, okay. And sometimes non-union can be painless if there is a pseudo joint formation between the two fracture site, which is called as pseudoarthrosis, and it is very common in case of non-union of the tibia. Here you can see this is your pseudoarthrosis of tibia, and it is pseudo yani false joint, pseudo yani false joint, and it is nothing but non-union, and characteristic feature is that this is a painless non-union. Okay, this is a painless non-union. Just remember this, that this is a painless non-union. This is pseudo-arthrosis of the tibia, where you can see that a false joint is formed in the tibia due to the non-union. Okay, this is your pseudo-arthrosis of the tibia. So non-union दो टाइप का हो सकता है, एट्रोफिक या हाइपरट्रॉफिक. नाम से पता चल रहा है एट्रोफिक यानी यहाँ पे there will be no callus formation, any minimum or no callus formation. In hypertrophy the callus is present but it will not bridge the fracture site. This is your hypertrophic non-union. The commonest sites of non-union, the most common site is your fracture neck of femur. ये आप बोलते हैं एज अ डिक्टम कि फ्रैक्चर नेक ऑफ फीमर विल नेवर यूनाइट whereas fracture intertrochanteric femur will always unite. So fracture neck of femur never unite. That's why the treatment of choice, be it any age group, it is the surgical procedure. Okay, so neck of femur के अंदर scaphoid या distal 1/3 of the tibia or the distal 1/3 of the ulna or the lateral condyle of the humerus, all these are prone, and these type of fractures have high chances of non-union or the delayed union. Okay, and अगर कोई delayed union में है and ज़्यादा आपने weight bearing जल्दी करा दिया, stress दे दिया, it can lead to refracture also. Okay, so the radiological features which are suggestive of the non-union and the delayed union is that दोनों के अंदर fracture line will be visible, but in case of delayed union there will be callus present होगा, but that will not bridge the fracture site, whereas in the non-union the fracture will be completely absent or there will be minimal callus. Okay, fracture line दोनों में दिखेगी. In delayed union callus will be present, whereas in non-union callus will be very less or completely absent. Okay, remember this thing, or it will be completely absent. And the fracture sites will be ends will be the round, smooth and sclerotic. Here you can see the fracture ends जो होते हैं, the fracture ends here, they are round, smooth एंड स्क्लेरोटिक. सो इसके ट्रीटमेंट के लिए व्हाट यू डू, अगर डिलेड यूनियन है और कैलस बना हुआ है, यू कैन कंटिन्यू द सेम लाइन ऑफ ट्रीटमेंट फॉर फ्यू मोर मंथ्स बिकॉज कैलस इज देयर, वो हो जाएगा. अगर नॉन यूनियन है, सो व्हाट यू नीड टू डू, surgically you need to refracture it. Surgically you need to refracture it. You need to remove this round, smooth and sclerotic part because they will not help in the formation of the callus, and इसके बीच में you have to fix it internally by the implant and put the bone grafting. Okay, so we'll read all this यहाँ पे. So here you can see this is delayed union, not non-union, because here you can see that fracture line is there and also callus is there. Fracture line and callus दोनों है. So this is your delayed union. Okay, and इसको ठीक करने के लिए what you have done, you have removed this callus, you have undergone the internal fixation by plating, and you have bridged this gap by the with the help of bone grafting. Okay, and you have bridged this gap with the help of bone grafting. Okay, so very important, remember this thing. Okay, now most fractures in the delayed union unite on continuing the conservative treatment. Okay, delayed union we have discussed. और अगर फिर भी नहीं होता है, then you have to go for the ORIF, that is open reduction internal fixation with grafting. And graft आप लेते हो most commonly from the iliac crest. Okay, graft आप most commonly लेते हो iliac crest, and non union में भी आप यही करते हो, and the treatment of choice for non union is this only. Okay, or another option is excision of the fragments, like जो non functional fragments है, like the lower end of the ulna fracture, like distal 1/3 of the ulna or the neck of the femur, where you replace the head and you perform the hemiarthroplasty. So in elderly, the treatment of choice for the neck of femur fracture is hemiarthroplasty only. आप neck of femur को नहीं जोड़ते हो, you just remove the entire neck and the head part and you replace it with the help of prosthesis. Okay, here you can see, I guess I had a photo, there it is. Okay, so it is hemiarthroplasty, which is of two type, unipolar and bipolar. We do the bipolar, we have read it about all. Okay, and no treatment like some non-unions जो functionally आपको इम्पॉर्टेंट नहीं है, कोई साइंस एंड सिम्टम्स नहीं होते, उसमें आपको कोई ट्रीटमेंट की जरूरत नहीं होती है. एंड अ मेजर example and important example is the scaphoid, because non-union here is due to the AVN, avascular necrosis, and there will be no treatment required in case of scaphoid fractures. Okay, now Ilizaro, in case of non-union or even the malunion and the delayed union, you can use the Ilizaro technique, which will provide a normal biological environment for the fracture to heal. And here you can see this is the Ilizaro ring fixator, and you can treat the patient very easily. So Ilizaro is very important surgery in the orthopedics. Okay, so now we'll come to the next late complication of the fracture healing, that is your malunion. नाम से पता चल रहा है malunion यानी no, does not unite in a proper position. Okay, and what is the commonest cause of the malunion? The commonest cause of malunion is your improper treatment or the improper reduction. Okay, and commonest site is your supracondylar fracture of humerus, very common site of malunion, and it will lead to the most common complication of the supracondylar humerus, that is the Gunstock deformity, called as the एक condition called as the cubitus varus deformity. Okay, very important. And in the Colles fracture also malunion is very important. So a malunion hoga, so there will be deformity, there can be shortening of the limb, and there will be limitation of the movements of the limb. ओके, सो अ स्लाइट डिग्री ऑफ जनरली क्या होता है, मालयूनियन स्लाइट होते हैं एंड इट डज नॉट रिक्वायर एनी ट्रीटमेंट, लाइक इन सुप्राकॉन्डाइलर फ्रैक्चर ऑफ द ह्यूमरस आल्सो मेजरली कॉस्मेटिक प्रॉब्लम होती है. तो मालयूनियन जनरली दे डू नॉट रिक्वायर एनी ट्रीटमेंट. अगर ट्रीटमेंट है रिक्वायर्ड है यानी डिफॉर्मिटी बहुत ज्यादा है, लाइक इन सुप्राकॉन्डाइलर फ्रैक्चर ऑफ द ह्यूमरस, और देयर इज शॉर्टनिंग इन केस ऑफ लोअर लिम्स, और देयर इज फंक्शनल लिमिटेशंस लाइक इन द रोटेशन problem हो जाती है of the forearm in case of malunion of the forearm bones, then you have to go for the treatment. And the treatment of choice is that you open the fracture site, you refracture surgically, then you perform the open reduction internal fixation with grafting. Okay, this is your treatment of choice in case of any malunion. Just remember this. You can also go for the corrective osteotomy, like you go for the French osteotomy in case of cubitus varus deformity after fracture of supracondylar humerus. उसमें osteotomy करते हैं for the correction of the deformity, called as the French osteotomy. And you can also go for the excision of the protruding bone. And एक जो पुराने ज़माने में यूज़ करते थे वो था without surgically, you just refracture the bone by the manipulation, but this is called as the osteoclasis, not done nowadays. आपको नाम से पता होना चाहिए कि what is osteoclasis. Okay, here you can see it is a malunited Colles fracture. It is a malunited Colles fracture, and it is a malunited clavicle fracture. Okay, so यहाँ पे malunion will only be cosmetic problem, and here it can lead to the functional impairment like joint stiffness and arthritis etc, and the flexion and extension of the wrist नहीं हो पाएगा. Okay, so here is the malunited supracondylar fracture of the humerus. Okay, so जो रीमॉडलिंग होती है डिपेंड्स ऑन द एज, चिल्ड्रन में बेटर होती है, टाइप ऑफ द डिफॉर्मिटी लाइक साइडवेज शिफ्ट्स, एंगुलेशन एंड साइडवेज शिफ्ट। अगर क्वेश्चन आया कि विच इज हील्ड faster and better, sideways shift or the angulation, then the answer will be your sideways shift. And angulation में भी अगर plane of the joint में है, like in case of leg bone fracture, जो posterior angulation होता है, the posterior angulation will heal better. Okay, and location of the fracture near the joints यानी cancellous bones का जो fracture होता है उसमें remodeling will be better. Now, what is cross union? Cross union is a special type of late complication which is generally seen in fracture of both bone forearms, where क्या होता है, callus बन के the union जो होता है ये adjacent bones के साथ हो जाता है, very easily appreciable in the picture. So same incision से you do not operate both the bones of the forearm, इसलिए आप दोनों forearm bones में plating करते time you go for the different incision. For the radius के लिए you go for the incision in the anterior aspect, and for the ulna you go for the incision in the posterior aspects. Okay, so it is a malunion, wherein the two bones will unite with each other. Okay, this is your cross union. Okay, this is your cross union. Now, shortening is a very common complication due to the malunion की वजह से हो सकता है in the long bones of the lower limb. Okay, in the long bones of the lower limb, or there can be crushing due to crushing की वजह से shortening हो सकती है, bone loss like in open fractures or the gunshots, or if there is epiphyseal injury or the growth plate injury, there can be shortening due to the growth defect. तो ये ध्यान रखना, obviously it is कॉमन सेंस की अपर लिम के अंदर शॉर्टनिंग इज इजीली मैनेजेबल एंड इट गेट्स अननोटिस्ड, सो नो ट्रीटमेंट इज रिक्वायर्ड इन केस ऑफ अपर लिम शॉर्टनिंग. सो दिस इज गन शॉट इंजरी. हियर यू कैन सी द pallets of the gunshot, okay, with bone loss. Okay, so here obviously there will be shortening of the upper limb. Okay, so this is your gunshot injury. And in the lower limb, shortening, छोटी सी shortening will be very easily noticeable because there will be limping. Okay, there will be limping. Okay, so अगर 2 centimeter से कम है shortening, then it can be managed very easily by a deformity correction shoe or the shoe raise. Agar if it is more than 2 centimeter, so elderly may you go for the shoe raise only, and in younger patient you do the surgery called as the limb length equalization surgery, where you put a graft, a bone graft, or if you correct the angulation, or you correct the overlap by the necessary surgery. The deep में आपको नहीं जाना, just you need to remember that there will be a limb length equalization surgery. Okay, now we'll study about the avascular necrosis. Okay, तो avascular necrosis नाम से पता चल रहा है, avascular यानी blood supply नहीं आ पा रही है, तो उसकी वजह से there will be necrosis in the bone. Okay, and this will lead to deformation of the bone, and in the later stages or the final stages it will lead to secondary osteoarthritis, which is very painful, and there will be no movement of the joint. So three most common sites है avascular necrosis की जो आपको याद होनी चाहिए. First is the head of femur by the neck of femur fracture and the posterior dislocation. Very important is the neck of femur. Second is the scaphoid. अब scaphoid में क्या होता है, there are three parts: proximal 1/3, middle 1/3, and the distal 1/3. Proximal 1/3 is called the pole, the distal 1/3 is called your tubercle, and the middle 1/3 is called the waist, and इसमें भी the point of contact or the point at the junction of the middle and the proximal 1/3 is called as the waist. Okay, so remember, most common site of fracture is the waist, and most common site of AVN is your proximal 1/3. Okay, very important. Now similarly talus may be the site of fracture is your neck of the talus, but the avian will be of the body of the talus. So the three locations of the avian are very important and you need to remember this. Now there is staging and it is called as the Fickett Arlet classification or the Fickett Arlet staging, which is, so avian is classified into 4 stages on the basis of the skygrams के अंदर findings में. तो in stage 1 X-ray will be normal, but in MRI there will be small dead bones and edema etc. X-rays will be normal, whereas in stage 2 X-ray में changes आने लगेंगे. Okay, but there will be no collapse या जो typical sign होता है avian का, that is your crescent sign, that will be seen in the stage 3, and in stage 4 there will be secondary osteoarthritis, not primary, this will be the secondary osteoarthritis. So stage 3 में crescent sign दिखेगा but the joint space will be normal, whereas in the 4th stage there will be secondary osteoarthritis, reduced joint space. Okay, this is called as stage 4. So here you can see very easily कि in stage 1 X-ray normal, MRI में सिर्फ edema होगा. Stage 2 that is the pre-collapse, here you will have the subchondral cyst and sclerosis. In stage 3 there will be collapse, here you can see the crescent sign, very important, and necrosis in MRI. And stage 4 is your advanced arthritis. Okay, very important. So first sign is your sequential changes. First sign in the X-ray जो typical first sign होता है, that is your crescent sign. Then there will be osteoporosis, sclerosis, cystic changes, collapse, secondary osteoarthritis, etc. Okay, so what is crescent sign? Crescent sign is nothing but a linear cleft due to subchondral fracture. Okay, here you can see this linear line due to subchondral fracture. Okay, this is your crescent sign, very important in diagnosis of the avian. Okay, here you can see fracture of the scaphoid, and here you can see fracture जो है it is in the waist leading to the avian in the MRI easily appreciate हो रहा है, and osteoarthritis, which is the secondary osteoarthritis. Okay, which is the secondary osteoarthritis. Here you can see avian of the talus. Okay, now treatment जो होता है avian का, it depends on the bone, and the only treatment, एक बार avian हो गया, so you need to give the time for the revascularization, and the revascularization के लिए you need at least 6 to 8 months. अगर उसके बाद भी revascularization नहीं हो रहा है या osteoarthritis हो गया है, then you have to go for the surgical treatment, and the surgical treatment depends on the site. Like अगर femoral head का avian हो गया with osteoarthritis, then you have to go for the arthroplasty, and if it is of the scaphoid, then you go for the excision alone, and if it is for the talus, then you go for the arthrodesis. Okay, these are the treatment guidelines. Okay, now you can also do the revascularization, where you can put a vascularized bone graft at the fracture site so that revascularization हो जाए. And the ideal site for case of neck of femur is your bone graft, vascularized bone graft from your greater trochanter. Okay, remember this, vascularized bone graft from your greater trochanter. Okay, so excision in case of scaphoid, excision followed by replacement with the help of prosthesis in neck of femur. Okay, here you can see this is your neck of femur के अंदर. What is this? This is not your total arthroplasty, it is just your hemi arthroplasty, where only head is replaced, whereas acetabulum जो होता है, acetabulum is not replaced. So this is hemiarthroplasty. Okay, remember in case of fracture neck of femur. Okay, now next complication, it is also a late complication. It is the myositis ossificans, or also called as the post traumatic ossification. myositis ossificans or the post traumatic ossification बोलते हैं इसको. Okay, myositis ossificans or post-traumatic ossifications. This is a heterotrophic calcification. ओके, वेर देर इज जो हिमेटोमा बनता है फ्रैक्चर साइट पे, देर इज कैल्सिफिकेशन ऑफ दिस हिमेटोमा जनरली अराउंड द जॉइंट एंड मोस्ट कॉमनली इन्वॉल्व इज द एल्बो जॉइंट. ये याद रखना है, एल्बो जॉइंट इज द मोस्ट कॉमनली इन्वॉल्व जॉइंट. सो हिमेटोमा में देर विल बी ऑसिफिकेशन, सो इट विल लीड टू रिस्ट्रिक्शन इन द जॉइंट मूवमेंट्स एंड इट विल लीड टू joint stiffness. Okay, and most commonly elbow joint में होता है and most commonly children में होता है because periosteum loosely attached होता है उनसे, and if there is stripping off or the injury to the periosteum and the capsule. Okay, capsule and periosteum of the bone अगर injured हो जाती है, then there are high chances of myositis ossificans, and there are high chances of this myositis ossificans in case of patients with head injury and paraplegia. And बहुत important factor especially in the Indian scenario is your massage by the quacks, and North India में उनको बोलते हैं पहलवान. Okay, so massaging by the quacks will lead to myositis ossificans and it will aggravate it. So massaging of any bone for the treatment of even the osteoarthritis or the fracture etc. is highly objected. Okay, and you should never go for the massaging. Okay, it is not good practice, and but it is very common practice in India. So बहुत ज़्यादा अवेयरनेस की ज़रूरत है इस चीज़ के लिए. सो इट इज़ अ हेट्रोट्रोपिक ऑसिफिकेशन. मोस्ट कॉमन साइट इज एल्बो जॉइंट, दैट इज एंड एट दी, अगर पूछे लॉन्ग बोन में साइट, देन इट इज मोस्ट कॉमनली इन द डायफाइसिस. नाउ देयर इज अ peculiar condition which is associated with this myositis ossification, which is called as the fibrodysplasia, या पूरा नाम होता है fibrodysplasia ossificans progressiva. So it is also a heterotropic calcification or ossification rare type due to ACVR जीन के अंदर म्यूटेशन की वजह से होता है, पोस्ट ट्रोमेटिक ही होता है. इसके अंदर क्या होता है, फाइब्रोडिस्प्लेजिया ऑसिफिकेंस प्रोग्रेसिवा यानी पूरी बॉडी में ही देयर विल बी हेट्रोट्रोपिक ossification like this seen in the image. So this is your fibrodysplasia ossificans progressiva. So there is मेजर डिफरेंस बिटवीन ऑसिफिकेशन एंड कैल्सिफिकेशन, और ये एक बहुत बेसिक चीज़ है जो सब बच्चों को आनी चाहिए कि व्हाट इज द डिफरेंस बिटवीन ऑसिफिकेशन एंड कैल्सिफिकेशन. सो ऑसिफिकेशन होता है न्यू बोन फॉर्मेशन, और ये हमेशा बोन के अंदर ही होगा, whereas calcification is the सॉफ्ट टिश्यू जो होता है उसका कैल्सिफिकेशन या मिनरलाइजेशन एंड हार्डनिंग. तो ये बोन के साथ साथ में अदर टिश्यूज के अंदर भी हो सकता है. ओके, सो ऑसिफिकेशन इज नॉट अ पैथोलॉजिकल कंडीशन, whereas calcification at abnormal location is a pathological condition. Okay, remember this basic चीज याद होनी चाहिए, differentiation याद होना चाहिए कि what is the differentiation between ossification and calcification. Here you can see elbow joint के around there is heterotropic calcification यानी myositis ossificans. And ध्यान रखना, this myositis it is a misnomer because there is no inflammation of the muscles. Okay, यहाँ पे कोई इन मसल इन्फ्लेमेशन नहीं होता है. तो दिस मायोसाइटिस इज अ मिसनोमर. एंड हियर आल्सो यू कैन सी द ट्रीटमेंट जो होता है सॉरी, ट्रीटमेंट से पहले वील सी अ हिस्टोलॉजी एंड हिस्टोलॉजी ऑफ मायोसाइटिस ऑसिफिकेंस जो होती है एक पेक्यूलियर हिस्टोलॉजी होती है, दैट इज योर जोनल पैटर्न। जोनल पैटर्न में क्या होता है, इसमें दो जोन्स होती है। फर्स्ट इज योर आउटर जोन विच इज कॉल्ड एज द पेरिफेरी, जहाँ पे क्या होता है, देयर इज मेच्योर लेमुलर और द इमेच्योर वूवन बोन, यानी प्रॉपर बोन होती है इन द पेरिफेरी, एंड इन द सेंटर ऑफ द लीजन क्या होगा, देयर विल बी soft immature fibroblasts, okay, and it will be soft, whereas the periphery will be hard, and in center mein there will be immature fibroblasts. And remember, there will be no cellular atypia, okay, cellular atypia nahi hoga. So here you can see outer mature bone with inner soft hemorrhagic center, okay. So outermost zone jo hota hai, here you can see the outermost zone is your mature lamellar bone surrounded by the loose fibrous tissue, whereas in the inner zone there will be fibroblasts and osteoblasts, and it will not be hard. So treatment जो होता है, generally the prognosis is गुड, इट इज अ सेल्फ लिमिटिंग डिजीजेस, एंड 1 ईयर के बाद ये अपने आप ही इट बिगिंस टू डिक्रीज, सो प्रोग्नोसिस इज गुड. सो ट्रीटमेंट, एक तो मसाज इज हाईली कॉन्ट्राइंडिकेटेड एंड स्ट्रिक्टली प्रोहिबिटेड इन द अर्ली स्टेजेस. क्या होता है, जो अक्यूट फेज होती है अर्ली स्टेजेस में, रेस्ट and NSAIDs are important, and in the later stages you go for the physiotherapy. जो acute phase होता है, you इसमें you will not go for the stretching or the physiotherapy, but in the later stages you go for the physiotherapy, ओके क्योंकि आपने अक्यूट स्टेज में फिजियोथेरेपी या स्ट्रेचिंग कर दी, तो इट विल लीड टू मोर ऑसिफिकेशन और हेट्रोट्रोपिक ऑसिफिकेशन और ज़्यादा हो जाएगा. एंड अगर स्टिफनेस बहुत ज़्यादा है या फंक्शनैलिटी पूरी चली गई है जॉइंट की, देन यू हैव टू सर्जिकली एक्साइज द बोन मास, देन यू हैव टू गो फॉर द सर्जिकल एक्सीजन ऑफ द बोन मास, ओके. सो नॉन ऑपरेटिव इज रेस्ट, range of motion exercises, and passive stretching is contraindicated, and surgical excision ये ध्यान रखना आप अक्यूट फेज में कभी नहीं करोगे, क्योंकि अगर आपने अक्यूट फेज में कर दिया यानी विद इन 6 to 12 months कर दिया, देयर विल बी लोकल रिकरेंस, okay. So indicated if it remains a problem after it matures, that is especially after 1 year or yeah at least 6 months, then acute phase के बाद ही you will go for the surgical excision, okay. Now the last late complication that we'll discuss today is your Sudeck's osteodystrophy or the Sudeck's dystrophy, जिसके बहुत सारे नाम है. Sudeck's dystrophy आते ही आपको ये इमेज याद में आनी चाहिए, तो इससे आपको पता चल जाएगा यस हैंड्स में होता है and it is related to the pain etc. So Sudeck's dystrophy also called as the reflex sympathetic dystrophy. Sudeck's dystrophy, reflex sympathetic dystrophy or CRPS, that is complex regional pain syndrome, or called as the shoulder hand syndrome, or called as the causalgia, okay. ये सारे इसी के ही नाम हैं, remember this. and इस कंडीशन में क्या होगा, there will be burning, pain, stiffness, swelling and discoloration, and most commonly affected part is your hand. हैंड में ही होता है जनरली आफ्टर द फ्रैक्चर ऑफ द बोन फोरआर्म्स और द कोलीज फ्रैक्चर, रिस्ट फ्रैक्चर, इफ यू, एंड मोस्ट कॉमनली सीन आफ्टर conservative treatment, okay, most commonly seen after the conservative treatment, okay. This is your Sudeck's osteodystrophy or the complex regional pain syndrome, reflex sympathetic dystrophy, shoulder hand syndrome और the causalgia. तो इसमें भी क्या होती है, 3 stages होती है, and हर stage का एक पैथोग्नोमिक फीचर होता है. तो फर्स्ट स्टेज इज योर अक्यूट स्टेज विच लास्ट फॉर अप टू 3 months, एंड इसमें द पैथोग्नोमिक फीचर इज द पेन. Pain is out of proportion, more constant and long lasting as compared to the expected pain with the given injury, and touch करते ही there will be increased sensitivity to the pain, and the pain will be burning pain. Remember, the pain will be the burning pain, and the part of the affected limb will be warmth, the part will be warm and there will be redness. Okay, there will be excessive sweating, and excessive hair growth, that is hyperhidrosis, etc. ये सारी चीजें you should remember. Here this is your acute phase. Okay, redness, warmth, swelling, etc. and pain जो फोटो में नहीं दिखा. Second is your dystrophic stage which lasts for 3 months to 12 months and इसका जो pathognomic feature होता है that is your swelling. तो इसमें the limb is now cold, कूलर एंड रेडनेस भी कम हो गई है एंड स्वेलिंग बढ़ गई है. सो स्वेलिंग विल बी मोर कांस्टेंट, रिंकल्स विल डिसअपियर, फिंगर नेल्स एंड स्किन ब्रिटल होना स्टार्ट हो जाएगी. पेन पहले जितना बर्निंग पेन या इतना सेंसिटिव पेन नहीं रहेगा, बट यस पेन विल बी there, but it will be more widespread, and important is that stiffness will be increased. Okay, stiffness will be increased. So here you can see the second stage, that is the dystrophic stage. The third stage is the atrophic stage after 1 year, and यहाँ पे नाम से पता चला there will be atrophy. So the skin will be pale, dry, shiny. Okay, and बहुत ज़्यादा stiffness हो जाती है. So and there are very less chances of gaining the entire functionality by the physiotherapy alone, and pain will be lesser, very less as compared to the first two stages. So cardinal sign: pain in the acute stage, swelling in the dystrophic stage, stiffness and the skin discoloration in the atrophic stage. There will be vasomotor disturbances, skin changes, hyperhidrosis. नी इन्वॉल्व हुई है तो एक तो फ्लेमिंगो गेट होगा एंड हमेशा पटेला का इन्वॉल्वमेंट होगा. ये ध्यान रखना है आपको नी के केस में. एंड एंकल के केस में द मोस्ट कॉमन डिफॉर्मिटी विल बी योर इक्वाइनोवेरस डिफॉर्मिटी. रिमेंबर दिस ऑल्सो. Radiographs, X-ray में what you will see osteopenia, decreased joint spaces, and osteopenia with subperiosteal bone resorption. Okay, so here you can see in the image osteopenia is there, decreased joint space you can see, and there will be, here you can see this is your increased periosteal reaction, and there is increased periosteal reaction. Okay, अब इसके डायग्नोसिस के लिए आपको एक चीज ध्यान रखनी है कि there is an important special 3-phase bone scan. इसके डीप में जाना जरूरत नहीं है, बस एक बोन स्कैन होता है 3-phase बोन स्कैन, जिसमें phase 3 is the most sensitive, and in all phases you will have increased uptake. Okay, this is the picture of the 3-phase bone scan used for the diagnosis of Sudeck's osteodystrophy. Okay, here you can see osteopenia, etc. in the case of Sudeck's osteodystrophy. So this was all about today's lecture. All the questions of the NEET PG 21 from were covered in the YouTube sessions of the special classes and the other sessions taken by me. Every question were discussed with me by us, even as it is questions जो थे वो भी discuss हुए थे. So you can trust us, you can trust your Unacademy for NEET PG preparation. Okay, so thanks for watching the video. I hope you like the video. अगर अच्छा लगा हो तो please like, share and subscribe. And today I will upload a recorded video. I will do the premiere of a video which is Inside Ortho OT Part 1. जो पहले due to some technical issues the video were not playing. So अच्छे से I have prepared the session now, and here you can get the real-time view of inside the OT. And in first video I'll tell you about the basic preparations before the surgery, that how to wash the hands, how to wear the gown and the gloves, how to paint the surgical site and drape the surgical site. It will be very very interesting for you, so please watch that session. छोटा सा सेशन है, 30 मिनट्स का ही सेशन है, उसमें से भी वीडियोज आर ऑफ लाइक 10 to 15 मिनट्स की ओनली. सो प्लीज डू वॉच द वीडियो एंड प्लीज लाइक, शेयर एंड सब्सक्राइब एंड कमेंट इन द लाइव चैट बॉक्स. कमेंट कि यस आपको ऐसा किस तरह के और क्लिनिकल वीडियोज चाहिए. आई विल फॉर्म इट फॉर यू. सो यू कैन यूज माई कोड while subscribing on any Unacademy subscription code to get extra 10%